Will healthcare professionals face audits for Medicare billing practices? In recent news, healthcare professionals are facing an increase in audits related to Medicare billing practices. This topic has become especially important as the Centers for Medicare and Medicaid Services has made significant changes to its audit programs. If you are a healthcare provider, you may be wondering how this could affect you and your practice. Just this week, it was announced that the Risk Adjustment Data Validation Audit Program will now encompass every Medicare Advantage plan each year. Previously, only a small sample of plans were audited annually. This means that healthcare professionals should prepare for a rise in audit activity. The Centers for Medicare and Medicaid Services will now audit all eligible Medicare Advantage contracts, which total around 550. Each plan will see an increase in the number of medical records audited from 35 to as many as 200 annually. This is a significant change that will impact many providers. To handle this expanded workload, the Centers for Medicare and Medicaid Services is increasing its team of medical coders from 40 to approximately 2,000 by September 2025. This move reflects the growing need for thorough audits and accurate coding in the Medicare Advantage program. Healthcare professionals can expect to receive more medical record requests and tighter deadlines for their responses. It is essential for providers to validate the diagnosis codes used in risk score calculations. The Centers for Medicare and Medicaid Services uses these audits to ensure that payments to Medicare Advantage plans accurately reflected the health status of enrollees. Failure to comply with these audits or inaccuracies in documentation could lead to recoupment of overpayments. This could also result in potential legal or financial consequences for healthcare providers. The American Medical Association supports efforts to strengthen the integrity of the Medicare Advantage program. However, they have raised concerns about the increased administrative burden on physicians. Providers are encouraged to document any challenges they face in responding to these audits. It is also important to communicate feedback to advocacy groups to address these issues. In addition to risk adjustment data validation audits, healthcare professionals should be aware of other risks. Medicare and Medicaid enrollment revocations and audits from the Office of Inspector General remains potential issues if billing practices are found to be non-compliant. Responding promptly and carefully to any inquiries from the Centers for Medicare and Medicaid Services or the Office of Inspector General is vital. This is crucial for protecting a provider's ability to bill Medicare and maintain their professional standing. Healthcare professionals involved with Medicare billing, particularly those working with Medicare Advantage plans, should prepare for more frequent and intensive audits. Staying organized, responding promptly to record requests, and ensuring accurate documentation will be essential in navigating this evolving audit environment.